And good afternoon, and thank you for joining us for today's COVID-19 media briefing. This is a Q&A about vaccine. It is being aired live on YouTube. Joining us today, DHS Deputy Secretary Julie Willems-Van Dyke and Dr. Stephanie Schauer, Division of Public Health Immunization Program Manager and part of our COVID response team. We'll begin the briefing with remarks from the Deputy Secretary, from Julie Willems-Van Dyke.
Thank you, Elizabeth, and good afternoon, everyone, and thank you for joining us. As of today, 1,568,334 doses of COVID-19 vaccine have been administered in Wisconsin. 553,773 individuals have completed their vaccine series. Over a quarter of Wisconsinites aged 65 or older have completed both doses of their vaccine series. We continue to be among the top states in the nation for vaccine administration, and we lead the Great Lakes states in vaccine administered per capita. We are making significant progress, and the addition of the Johnson & Johnson vaccine to our federal allocation and the news of increased production for all three vaccines means our state will get more vaccine. Throughout the COVID-19 vaccine effort, we have continued to refine and improve our systems and processes, and with more vaccine supply, we will be able to more effectively utilize our network of vaccinators across Wisconsin to get shots in arms quickly, safely, and equitably. A great example of a process that is working and our vaccinators doing great work is the fact that after reviewing the plans submitted by local health departments and school districts, we will be able to meet everyone's first request, meaning that the majority of our teachers and K-12 staff will be able to get vaccinated this month. We are making great progress, and I'm so proud of our team and our partners across the state. Of course, there have been bumps in the road, and I'm sure there will be more, but if and when that happens, we'll tell you and we'll fix it. For example, we were a day late launching the vaccine registry to assist local and tribal health departments in registering residents for appointments. This brief delay was because we were working with Microsoft to improve the vaccine registry user experience for anyone registering and to ensure that the waitlist functionality was working correctly for vaccine providers. Now that the site is up, we will continue to work on improvements to the system and to bring more vaccinators on board to use it in the coming weeks and months. Today, we are also announcing a vaccine assistance hotline. So if you need answers to questions about vaccine provider locations, need help with the registry, or just want to learn more about COVID-19 vaccine, you can call 844-684-1064. I'm going to repeat that, 844-684-1064. We're excited about these new developments and proud of the work of our vaccine provider partners our vaccine providers have done across Wisconsin. And we look forward to continuing to grow and improve our effort. As we do that, let's please remember that COVID-19 is still very present in Wisconsin. In fact, we have confirmed more cases of the B.1.1.7 variant, the more infectious variant originally found in the United Kingdom. We now have a total of 19 identified cases in the state. We must each do everything we can to stop the spread. For those of you who are eligible, please get your vaccine. And for all of us who are still waiting, we need to continue doing what we know works. Washing our hands, staying home, wearing a mask, and physically distancing when we do need to go out. We are so close, Wisconsin, and by combining increasing vaccine with strong preventive behaviors, we will reduce the threat of COVID-19 in our state. So thank you, and let me turn it back to Elizabeth to entertain your questions.
Thank you. And as we do take your questions, we remind you to maintain audio quality, remain muted until it's time to ask your question. If you're on the phone and you can do so, use *6 to mute and unmute. And we begin with Eric Gunn at the Wisconsin Examiner. Eric.
Hi, thank you. You've just mentioned the numbers about the variant, and as of yesterday, there seemed to be a definite uptick in positivity rates on testing in general. I know you've already expressed concern about the decline in positive cases might be leveling off. So I'm wondering if measures are being taken right now in response to this latest turn in the data, and how concerned are you when you see that graph take that little uptick as it did yesterday?
Yep. Well, Eric, I am concerned, and I think that's why it's, I know we are all tempted to just be done, right? Spring is coming. It's been a year of coping with COVID-19. We are sick of staying home. We are sick of isolation. We are sick of wearing masks. We are sick of physical distancing. I know that. I know that. But we're just not quite ready to let go of those protective behaviors for the very reason you are citing. A few more cases, that's how a surge starts. It doesn't go from 0 to 5,000 like this. It goes a little bit, a little bit, a little bit, and then all of a sudden you look back and you're like, wow, this has really increased dramatically. And so we're watching every day. We've identified 19 variants, or 19 cases of the B117 variant. Again, I want to remind people, only a small percentage of tests are actually genomically sequenced for these variants. So there could be far more than 19. And the issue with these variants is that they are much more effective at transmitting disease from person to person. So you can even be doing all of the good protective behaviors, but you just have a little lapse. Take your mask off, don't wash your hands, stand too close to someone. And these are much more infectious, and you're more likely to get COVID-19 if you're in the presence of someone who has who is infected with one of these variants. So that's why, yes, we're concerned, and that is why we really are encouraging people to keep physical distancing, keep your social circles as small as you can. If you want to see friends and family, please go outside and see them. We know transmission is much less outside, and it's going to be a beautiful weekend. So visit with your family outside, not inside, and keep 6 feet apart. And if we can do that for another couple of months while we ramp up vaccine and get our coverage of people much higher, we're going to be in much better shape. We have encouraging signs about vaccine supply so that many more Wisconsinites are going to be eligible and going to be able to receive the vaccine soon. So thank you for the question. We are concerned. We just need a couple more months to bring up vaccine supply, use our protective behaviors to bring disease rates down, and we'll be on the other side of this.
Thank you for that. Let's go now to Rob Sussman at WTAQ in Green Bay. Rob Sussman.
Hi, yes, thanks for taking my question. My question is kind of related to the way the trajectories have been going. You had mentioned that it's going to take a few more months to get back to normal, and I know that this 80% number has been thrown around quite often, but given the fact that, some of the most at-risk populations for death, the 65 plus, have, been we're approaching half of them being vaccinated in full. At what point does the death rate get low enough to where we can really start looking at opening things up and perhaps letting the mask mandate expire, so on and so forth? I mean, do we have any thresholds that have been spoken of in that regard?
Well, I think we're not going to look at deaths. We're probably going to look at cases, which will be, because we don't know, Rob, which case is going to be transmitted to someone that could lead to someone who's susceptible and could die. It's just not quite that simple. So we want to bring the total number of cases down. Now, as concerning as little upticks in cases are, we're also seeing some good trends. If you look at our map of disease activity across the state, for the first time in months, you now see several counties in our state with a low disease activity rate. And that means it's under 10 per 100,000 over the last 2 weeks. So if we can get to a place where it's not 4 counties at low disease activity, but it's closer to 72 counties at disease activity, I think we'll be approaching that. We've seen good results with the vaccine. We've seen reductions in cases in long-term care facilities who have been vaccinated for the longest period of time. And so, again, this is a very effective vaccine, but even at 95%, if you're having thousands and thousands of cases and 5% of your population is, you still have a 5% risk of acquiring the disease, that is a whole different scenario than if you have almost no diseases with 95% protection. So disease level and immunization coverage go hand in hand in order for us to make the decisions about when it's going to be safe to retreat back from things like the mask mandate. Dr. Schauer, anything you would add to that?
Yeah, no, and I think, one of the things also just to add in is, as we think about preventing deaths, it's also important to recognize that COVID disease is serious. And while many may recover without sequelae, there are also many more who have long-lasting effects. And we're still learning the impact of having had COVID disease. And so I think certainly prevention is important. And as Deputy Secretary talks about, it's really cases. We're trying to prevent that infection to start with because there are so many unknowns when it comes to infection with the COVID-19.
Thank you for that. Let's go now with our next question to Stephanie Hoff at WisPolitics. Stephanie Hoff.
Good afternoon, and thanks for taking my call today. My question is about this new COVID-19 hotline. I'm wondering who staffs the hotline? Did you guys have to add positions, and where does the money come from?
Yeah, we've contracted for the hotline. We have looked at the experience of other states and know oftentimes when you open hotlines like this, you're getting tens of thousands of calls. And so we wanted to work with an organization that are professionals at this. It's actually staffed by 2 different organizations, by 211 Wisconsin and by another group called T-Tech. And so we are very well prepared for calls coming in all across Wisconsin and to meet the needs of our residents when they call us. And the funding for this is provided by the CDC through the immunization funding to support this effort nationally.
Thank you for that. The next question to Ben Krumholtz, Fox 11 in Green Bay. Ben.
Hi, thank you for the opportunity. Could you elaborate on the success that you say that you're seeing at the long-term care facilities? Are you seeing any cases, and if so, just about how many?
Dr. Schauer, do you have any further information about cases in long-term care facilities or the success of the vaccine campaign?
Yeah, I don't have specific case information. What I can say is regarding the pharmacy partnership program. So this is with CVS and Walgreens, who are vaccinating the skilled nursing facilities and the assisted living, is that they continue to do a robust vaccination. Right now, they are about 42% of the way through their third clinics at the skilled nursing facilities, and about 44% of the way through those offering those second clinics, for a total of over 155,000 doses administered amongst both staff as well as patients. So we are seeing lots of vaccination occurring and continuing to finish up the series and provide protection to residents and staff alike in those facilities. And I think that really does contribute nationally. There have been reports, as noted earlier, about the decrease in the amount of cases and deaths in nursing homes.
And another factor that I think supports what we're saying is the Centers for Medicaid and Medicare Services works very closely with our Division of Quality Assurance, which is the group of folks at DHS that regulate and inspect nursing homes. Throughout the pandemic, CMS has monitored active outbreaks in nursing homes and sent a list every week to our inspectors about how many nursing homes they need to inspect because of active outbreaks. You know, during the peak of the pandemic, they were going to 50, 60, I think even 70 nursing homes in a week. And for the last few weeks, that's been in the single digits. And for next week, we have 0 nursing homes to inspect. So I think, again, this is an indicator that we're seeing less outbreaks and that we're seeing a reduction in disease transmission in those facilities.
Thank you for that. Let's go now to David Wahlberg at the Wisconsin State Journal. David Wahlberg.
Thank you. How many doses of vaccine are you expecting for all 3 of the vaccines next week and the following week and coming week? And on Tuesday, you said you might announce when the next eligible groups might be able to be getting their vaccine and who they will be. You said that might come very soon. Are you ready to announce that yet?
Well, David, I think if I were, that would have probably been in my opening remarks. We're still working on that, and our plan is to announce that sometime next week. So hang tight on that, and we're very close, but not quite there yet. In terms of our allocation, last week, I don't have the precise number, but we had about 123,000 first doses of Pfizer and Moderna. And then, as you recall, we received this bolus of J&J vaccine of nearly 48,000 doses. But that was one time. And as we were informed, we were not likely to see additional J&J for a few weeks until closer to the end of the month. So our allocation going into next week is about 129,000 Pfizer and Moderna doses. And that represents an increase at the federal level from 14.5 million doses distributed to 15.2 million. And we have been told that that would be the floor for the next 3 weeks, that 15.2 million doses across the nation, translating into about 129,000 doses here in Wisconsin. And it's possible we'll see more. That often has happened, but that when the federal government gives us a 3-week window, they give us what the floor is, and that's where we're at.
Thank you for that. The next question to Heather Poltrock, WSAW in Wausau. Heather.
Hi, this question is about the Johnson & Johnson vaccine. When that was approved and you were notified how many doses that you were getting, what needed to occur on the state's end to receive that vaccine? Who did you need to call, or what plan did you need to put into place? And because this is the third vaccine approval, can you share if there was any lessons learned from the first and second approval that helped prepare for this arrival?
Great. Well, Dr. Schauer, you want to talk about what some of the systems changes and preparation there are when we receive a new vaccine?
Sure, certainly. So the behind the scenes piece of it that is needed is with the Wisconsin Immunization Registry. This is a key piece of the immunization documentation as well as the ordering. And so that system, as well as I will say electronic medical records, et cetera, need to go ahead and program that particular vaccine and the specific information like their NDC code, et cetera, dose size, into those systems and test and make sure that they can accurately place orders and record the doses and that that information can be transmitted. So that all happens behind the scenes, and much of that can be done ahead of time. What we do also need then is the schedule and the clinical information that goes into the Wisconsin Immunization Registry. So putting in the schedule, is it a one-dose series? What's the minimum age? And so some of that information we can't go ahead and put in until the ACIP meets and makes those decisions. Some of that information was available ahead of time, but we always need to be sure that we're on target and are using the information that's been agreed upon by ACIP. So all of that happens behind the scene, and I'm happy to say that the Wisconsin Immunization Registry is ready to go. On all fronts. We can place orders, and providers, as soon as they are receiving this vaccine, can now submit that information to the registry. So that's sort of one piece behind it. And as I said, electronic medical records also have to do similar types of work on their end to go ahead and put that information in their systems so that they can accurately send that information. It's so key to make sure that we've got the correct information and that they can provide which vaccine it is. With the COVID-19 vaccines, now there being 3 vaccines, and that it's important to match the first dose with the second dose when it comes to the mRNA vaccines, as well as knowing when somebody receives a dose of COVID-19 vaccine, if it's the Johnson & Johnson product, they're done. There's no more vaccine doses that are forecasted or needed. And so it's really important that that information is complete and accurate.
Wonderful, thank you. We go now to Danny Maxwell at WKOW in Madison. Danny Maxwell.
Hello, this is AJ Byapour filling in for Danny. Thank you for doing the call and taking my question. One group of people we've started hearing more from in recent days are folks with pre-existing conditions. I know that the latest CDC recommendations have that group listed in phase 1C. For folks younger than 65 with pre-existing medical conditions, where is the state in its process of determining where they will stand in terms of becoming eligible, and where is the SDMAC in the process of finalizing the entire list of who will be in the next phase?
Yep. So I'm glad you recognize that the CDC has indicated that this group of people under the age of 65 with pre-existing conditions is phase 1C. We have just begun phase 1B on March 1st, and so 1C is coming soon. And so we are in the process of finalizing who will be in phase 1C, and that is the information that we are planning to release next week. I'll just take a moment to say, you know, it sounds like a fairly simple group, right? People age 16 to 64 with pre-existing conditions. But part of the decision making is thinking about which pre-existing conditions and really using the CDC's research to look at where the strongest evidence is about which conditions contribute to COVID-19. And as I've often heard Dr. Westergaard reference, is that we are trying to make these decisions right now in an environment where we have much better research than we did a year ago. So when I think about March of 2020 compared to March of 21, we know so much more about this disease. But when you think about how long other diseases have been studied, other communicable diseases like HIV or hepatitis C or Ebola or Zika or other emerging infections, we've had years to look at those infections or those diseases and understand the contributing causes. So we're still pretty much in our infancy around understanding that. And so it's complex to try and hit the notes just right, to include people who we know are at risk, to think about, do we put people who might be at risk, and how do we do this in a way that doesn't overwhelm the vaccinating system? Because while we are looking forward to more vaccine, we've made great progress over the last month, we know we still have far more people who want vaccine than can receive vaccine. And we know especially when we turn the on button for people with chronic conditions who have been waiting so desperately to have their day to have vaccine, they're going to want to be front in the line. So those are the decisions we're working through right now, and we'll be announcing this next week. I have full belief that that is when you will get further information.
Thank you for that. Let's go now to Tim Stum at Wisconsin Health News. Tim Stum.
Hi, thank you for holding this call today. Does the state have authority to delay second doses of the Moderna or Pfizer vaccines? And if so, given the increasing evidence of the effectiveness of one shot of Pfizer, coupled with, as was mentioned today, the growing concern over the emergence of variants, is the state at all considering delaying the second Pfizer shots, at least temporarily, while vaccine supply catches up with demand?
So the state is functioning under the guidance of the FDA and the requirements of the emergency use authorization. And that is what guides our utilization of these vaccines. At this point in time, the FDA has not issued new guidance to allow only one dose of the Pfizer or Moderna vaccines, or to extend the period of time between the two doses. Let me turn to Dr. Schauer and see if she has further thoughts about that, about the pros and cons of extending the time period between that first and second dose.
Yeah, the data has supported, and we've seen the increase that, if someone is unable to receive that second dose in that time for the appropriately recommended time frame, so either 21 or 28 days, depending on which vaccine, that they have made an allowance that you can go ahead and receive it up to 42 days after, and that the data supports that you'll have the benefit of the full protection of this series. We just don't have data to support that, the lengthening out of that. And I think not wanting to put people perhaps with a false sense of security that there is more protection there for sort of past that period than we really have the data to support. So we continue to follow ACIP, and certainly, if the data is submitted and it's reviewed and they make their recommendation to change, that I think is something that the state could consider. But right now, continuing to really work with that evidence-based. The J&J vaccine was authorized as a one dose, and it really was measured to meet the particular markers of that, whereas the other two really, the data is there and supported to be a two-dose series. And so that's how it's been reviewed and authorized at this point.
Thank you. The next question to Madeline Anderson, Fox 6 in Milwaukee. Madeline.
Hi, so with the Brewers announcing that they'll allow some fans in the stands, and at least in the Milwaukee area, museums are starting to open up, is there concern, given those examples and just with spring break approaching, and as you said, general pandemic fatigue, that Wisconsinites may be rushing to get back to normal before it's safe to do so? Thank you.
Well, I think a couple of things. One is as we start to move back to normal, it's not going from mass social distancing, good hand hygiene, good respiratory etiquette to none of that, right? So when you talk about the Brewers, it's a big outdoor stadium, right? At least most of the time when the roof is open on a beautiful day. So outdoor activity, much less risk associated with outdoor activity than indoor activity. Again, if you think about museums, if you reduce the number of people who are allowed into the museum so that they're usually pretty big spaces that you can have attendees visit the museum and still be able to maintain 6 feet of distance from each other, wear their masks, avoid touching surfaces, using hand cleaning gel and washing their hands, it can be a relatively safe environment to be in. And so I don't think we go from no socializing, no activity, to everything is normal. We take these steps along the way, and that's why I know a number of our counties, like Milwaukee County, like Dane County, are putting occupancy or number restrictions or percentage of people who can be in a certain space, and will gradually increase those. If, as we increase activity, we don't see surges in disease, and if we do, if we do start to go to the museum and the Brewers games and all of a sudden we start to see higher levels of disease activity, then we all need to understand we need to roll it back a little bit. So it's going to be a calibrating process as we move through this, but it's not going to go from complete COVID to complete non-COVID. We're going to go restrictions. We're going to go step by step by step. And we're going to be doing all of that as more and more of us get vaccinated. And that will also help stem that risk of disease transmission. So I think we just all have to think about it as step by step, and we have to think, what is my own risk? Do I want to be out and about? Am I vaccinated? And how long could I wait? And all of those things combined together, I think if we do this in a methodical way, we will be able to both start to enter into some of the activities that many of us love so much, like going to a baseball game on a Saturday evening or a Sunday afternoon, going to see the beautiful artwork at the Milwaukee Art Museum or any other museum in the state, and yet not take undue risks as we move to the other side of COVID.
Thank you for that. Let's give the next question now to Christina Leffering, Up North News. Christina at Up North News.
Hi, thanks for making the time and letting us ask questions. Mine is that since the Johnson & Johnson vaccine is effective after only 1 dose, is that going to affect who is going to receive that vaccine compared to the Moderna or the Pfizer vaccine, or how it's distributed?
Dr. Schauer, would you like to respond to that?
Yeah, sure. I mean, I think one of the advantages, as you noted, is that it is a 1-dose series and provides that protection much more quickly than the 2-dose. So I think there certainly are some situations where that is advantageous. We've certainly heard from individuals that that is something that they are very much interested in, is from an access point of view, and a time commitment, and needing to go only and receive the vaccine once rather than have to return back for the 2nd dose for that full protection, is really something that folks are keen on. So I think we will certainly see that it is going to be a vaccine that is well received and used in particular situations, or that people may indeed seek it out. It's important to note that all 3 vaccines provide good protection, and no matter what vaccine someone is offered, we really recommend that they step up and take the vaccine that's at hand rather than trying to search out a particular vaccine and remain unprotected for a bit longer. Anything to add?
I think that covers it.
Wonderful, thank you. Let's go now to Joshua Piguero, WBAY in Green Bay. Joshua at WBAY.
Hi, thank you so much for taking my call. One of the questions I wanted to ask is with, I know you mentioned earlier that there seems to be no outbreaks or the outbreaks have lessened at nursing homes and long-term care facilities. When are you thinking about reopening some of these long-term care facilities to visitors, allowing people to visit? And then a follow-up question, if you can, is, I don't know if this is a concern, but the Interpol just put out this report. It was covered in the Washington Post today about like counterfeit vaccines and how they're concerned about that. Is that anything y'all concerned about here?
Well, great. I'll go to the question about nursing homes. I do know that many of our nursing homes in the state have begun to have limited family visitation, particularly compassionate care, where they have at least one family member who may regularly visit residents. And so as we again see disease rates declining, as we see test positivity declining, and as we see more and more people receiving vaccine, I know our long-term care facilities are looking very closely at how they can open up visitation for more of their residents. Again, it's very similar to the question I answered about the museums and the ballparks. We're not going to go from no visitors to just open visitation. I think most facilities will want to go from one visitor at a time to maybe then going to 2 visitors at a time. Again, not wanting to have dozens and dozens of people in the facility, maybe limiting the space where people visit so people are not walking around the facility and interacting with lots and lots of residents. And again, as disease rates continue to decline and immunization rates continue to increase, that flexibility with more visitors and more interaction will increase. The other thing is, I know last summer was lovely for many folks in long-term care because they could have family visits outside. And not that long before spring's coming here, and we'll have that opportunity again. So as it goes to counterfeit vaccine, yes, we have heard that. And, you know, I think the important thing everybody should know is, for one thing, check our map. If you're going to get a vaccine, see if it's a place we have sent vaccine to. Nobody should be charging you for vaccine. If someone is offering you a deal that if you pay them money, you can get vaccine or you can get it earlier, that is a big red flag, because no one should be charging you for a spot in line or for the vaccine. The vaccine is provided to us in the state of Wisconsin by the federal government. We provide it to our vaccinators. It is free of charge. It is prepaid with your tax dollars. And so there should be no charge. Vaccinators may charge for the labor of administering the vaccine, but that is also during this public health emergency should be covered by your health insurance. And so if people are asking for money, that's a big red flag. Dr. Schauer, have you heard of anything else that we should alert people to in terms of counterfeit vaccine?
Yeah, no, I have not heard that, but I think we do continue to reiterate with our vaccine network of providers. There is a cadence to the whole vaccine cycle of requesting vaccine and how they get it, as well as the communications that we send out. So they're used to seeing the messages from us at a particular time and through a particular mechanism. And we have had a few instances of someone sending an email saying, this doesn't quite look right. This doesn't seem like it's from you and your normal DHS logo, and rightly so. And so we've been able to quickly alert folks. But by having that manner of routine, we hope that, and predictability in that respect, that our vaccinators know when information is coming from us and who to reach out if there are questions or concerns.
Thank you for that. Let's go now to Todd Richmond, Associated Press. Todd at the Associated Press.
Hi there. Got a two-part question, and they sort of go hand in hand. But the first part is, President Biden is saying that there's going to be enough vaccine for anyone who wants it, any adult who wants it, by the end of May. So assuming that's true, will vaccinators here in Wisconsin be able to administer that vaccine to everyone who wants it by the end of May? Or is that two different things? And my second part of the question is, several times, Julie, you had said that we just need a couple more months and we'll be on the other side of this. Can you define the other side? What does that look like?
Well, first of all, on your first question, Todd, I think the federal government is trying to provide us with their best information about what they foresee in terms of increased vaccine production and how they will then allocate it and get it out to the states and get it out through the various federal programs that they have. And based on what they've shared with us, I think eligibility for everybody in May is a very realistic goal. Now, it will depend on how many people we already have vaccinated in May, whether we'll be able to finish eligibility for everybody who wants in May. I think it's likely to go into June and maybe even early July, because it just depends on how many people are going to raise their hand and want to be in line, because we're not going to have unlimited vaccine supply. We'll just have enough to get to everyone. So what I hear in the president's statements is it will no longer be you have to be part of this eligibility group. You don't have to be someone over age 65. You don't have to be a teacher. You don't have to be, when we, assuming we open to people with chronic conditions, you just have to be an adult in Wisconsin and we'll be able to get vaccine. So it'll probably take a little bit of time after May to finish, but our vaccinators are ready every week. They ask for 300,000 to 400,000 vaccines a week, and I think it'll be somewhere close to that range that we'll be receiving at that point in time. And so they've raised their hand and said they're ready for it now. I can't imagine why they wouldn't be ready for it in May. So I think it is feasible. As to what the other side of COVID looks like, what I'd love it to look like is we've eliminated COVID. I think that's really the goal. I don't know if we'll get there. There are actually very few vaccine preventable diseases that we've actually eliminated. But the other side, to me, looks like we have controlled it, that the incidence of COVID is quite low, that everybody who wants a vaccine has access to a vaccine, that our research continues to go on so we know how long our vaccines are going to provide us with immunity, and that if immunity is waning, we have booster doses available, that we have a strong testing system in place so that we can easily identify if we're seeing new outbreaks of COVID, and people can take appropriate precautions, just like they do during the flu season. When flu numbers go up very high, many people who are susceptible to the flu stay home, don't socialize as much, certainly wash their hands more. In our country, it has not been traditional to go outside during flu season with a mask on, but that's not true in a number of other countries. And so the other side might look like there are periods of time where people go back to mask use. But I think in general, the other side looks like we won't be wearing masks every time we leave our house. So those are some of the attributes of what I think about when I think about the other side. I think this has been a very disruptive communicable disease event in our lives, and I think it will make all of us think differently about being out in public, touching public services, surfaces, washing our hands, how we cover our coughs. I hope it makes us all think much more carefully about whether you go to work when you're sick. I mean, if we could just stay home when we're sick, we could prevent lots of illness. But it also means, as a society, we have to take care of each other when we're sick. And so we have to have employers who understand sick people should stay home. And we also have to have people who don't lose their income when they stay home. And those are all some of the barriers that I know many people in our society have to managing communicable diseases in general. And those are all things that I think we have learned through COVID that hopefully will help us when we are on the other side.
Thank you for that. Next question now to Nick Bohr, WISN in Milwaukee. Nick, WISN.
Good afternoon. When will you reconvene the SDMAC subcommittee then? And given that you have a better idea now of vaccine availability, what's your current estimate for starting 1C?
Yeah, we are in conversation with the SDMAC. As I mentioned last week, we're using the counsel that they have given us. We're using the guidance of the Advisory Committee on Immunization Practice, and we're using the guidance of our chief medical officers at DHS to come to decisions about phase 1C and future phases. We are still looking for how phase 1B is going. We need a little bit more time to see how uptake will be proceeding through phase 1B. And it is generally after we've had a couple of weeks in a new phase that we have enough data to coupled with the data that we'll have about how much vaccine we can anticipate over the next 3 to 4 weeks for us to make a decision about when to open the next phase. So we're not quite ready to make a prediction on that yet, but we will be probably within the next 1 to 2 weeks.
Thank you. We go now to Katie Crowther, WTMJ in Milwaukee. Katie?
Hi. Yeah, I just wanted to ask, Governor Evers touched on this a little yesterday in talking about his support of schools potentially starting the fall earlier ahead of the typical date of September 1st due to the fact that there's better weather, so more outdoor learning chances, maybe ability to keep windows open, more ventilation, and also mentioning to really try and stop that COVID and summer slide or achievement gap. Will you, as the state health department, will you guys be working on any type of guidance or recommendations for school districts to start earlier for some of these reasons?
Well, we have excellent guidance from the Centers for Disease Control, and that was just updated and published a little over a week ago. And so at the State Department of Health Services, we're certainly referring school districts to that guidance. And those kind of accommodations that the governor was referencing in terms of, we call those environmental controls, ways to increase ventilation, ways to move instruction outside, ways to what we call cohort classrooms so they're not mixing and matching as much, so less disease transmission, are all strategies outlined in that CDC guidance. And so we'd strongly encourage schools to look to that guidance and deploy it to create safer environments. As we've talked about in other briefings, research across the world has shown that student-to-student transmission within classroom settings and student-to-teacher transmission are all fairly low, especially when those kind of controls are put in place. And of course, we're adding an additional layering protective effect for our teachers by vaccinating them. And, as you've heard earlier, by the end of this month, every teacher will have at least received their first dose. And by mid to late April, everybody will have received their second dose. And so another good strategy to help protect teachers. The other thing is we don't know where we'll be by the fall. I know the vaccine manufacturers are all working on testing the vaccine with children and younger populations, and we're hopeful that sometime, at least before the end of 2021, that we may see authorization of the vaccine in some portion of children. And so that when that becomes available, that will also help to contribute to safety in schools and further protection and decreased disease transmission.
Thank you. We go now to Jonathan Neisser, NBC 26 in Green Bay. John, NBC 26.
Yes, thank you. I know the new group of eligible individuals were just added with the education and child care folks being the priority over the other new groups, such as grocery store employees. Can you provide a sense of how that rollout to educators and the other new groups is going, and when you would expect those who are in that group but slightly lower priority, such as those grocery store employees, will likely get more widespread access?
Yeah, thank you. So again, it's the new groups. It's also continuing to finish people who were in the prior groups. So as of today, we're at 58.3% of people aged 65 and older who have been vaccinated. So again, we're making progress with that group. Well over half have received their vaccines. And we're starting to see districts across the state vaccinate teachers. So those first doses to teachers will be heavily loaded in the first 3 weeks of March. And then it will slow a bit in the latter part of March. While we're doing teachers, we still have a lot of vaccine available to our vaccinators to be vaccinating people over age 65, particularly in our health systems. And so I would say towards the end of March, we should have more vaccine available to disperse across those other groups. I also just want to pause and say, again, it's different with every vaccinator, with every community. Different communities are moving at different rates. And so all people in this eligibility group are eligible for vaccine right now. You don't have to sit there and say, well, I can't have a vaccine until every single person over age 65 and every teacher in my community is vaccinated. If you are reaching out to a vaccinator and they have slots available and you're a grocery store worker, get a vaccine. We know particularly at a number of our pharmacies, including the pharmacies included in the federal retail pharmacy program, that many of them have slots available at Walgreens, and now, as you've also heard, at Roundy's Pick and Saves throughout the state. So that's one option, but certainly I don't want anyone in the eligibility group to think they can't get a vaccine if an appointment becomes available to them. This is primarily a triaging strategy for the allocation of vaccine, but it will roll out just a little bit differently in every community and with every vaccinator.
Thank you for that. Next question to Daphne Chen at Milwaukee Journal Sentinel. Daphne Chen. And a reminder, *6 will mute and unmute your phone. Daphne Chen.
Hi, can you hear me?
Yes, go ahead, please.
For doing this. Yes, I was thinking about the people in prisons who are now in 1B and realized that correctional officers actually look like they were added to the eligibility at the same time as law enforcement and firefighters. When and how did that happen? Because I don't really remember, that being part of the SDMAC recommendations. Thanks.
Yep. No, we added police, fire, and correctional workers about the third week of January. We knew they were part of the essential workforce that was likely to be part of 1B, and we added those folks as we started to see trailing off of the healthcare workforce. And so that group has been eligible since about mid-January. And you are correct, Daphne, at the point in time that we added our first responders to our healthcare frontline personnel, we did add fire personnel, police personnel, and correctional officers all at the same time.
Thank you for that. The next question to Felicity Bosk, WQOW in Eau Claire. Felicity, WQOW.
Hi, I was wondering what the difference Wisconsin is seeing in the rate of vaccinations between residents of color and white residents.
So if you go to our website, you can see the data displayed there about coverage rates for each of the racial and ethnic groups. All of the people of color are lagging behind the coverage rates for white Wisconsinites. And this is a point that we are all deeply focused on and concerned on about how do we make sure there is adequate vaccine in communities where people of color live, and that all populations have the information they need to be able to make decisions about vaccination. So it is a focus of our work. There are a number of things that we have done to enhance vaccine access in communities of color. For example, we have assured that we would give the full allocation to all of our federally qualified community health centers who provide care in many neighborhoods that serve larger populations of people of color. In addition, we've made sure that our tribal health clinics receive their full allocation as well. Another element of our allocation strategy that assists with this is we, with our limited supply, we do adjust based on the social vulnerability index that doesn't simply look at racial or ethnic composition of a community, but looks at other factors like income, crowded housing, transit opportunities, so a variety of factors that provides more vaccine into communities where people may be facing barriers to get to vaccine. And beginning next week, we've also done an analysis to look beyond simply the federally qualified health centers, who are important partners in reaching the populations that have been most affected by COVID, but also looking at other providers who have made strides in vaccinating people of color. And we'll be looking at how we can look at our allocation formula to assure that those providers who have been vaccinating a higher percentage of people of color will receive a boost in their vaccine supply to continue to do that outreach to these populations who clearly are not getting as much vaccine as our white population, and who we want to make sure there is ready access to them.
Thank you for that. Let's go now to Brittany Lewis at CBS 58 in Milwaukee. Brittany, CBS 58.
Good afternoon. When might we see some more facilities like Miller Park, or I should say American Family Field, or other facilities like that where there may be more drive-through vaccination locations for people, or does that depend on different cities?
Yeah, the vaccination delivery system is largely run by local communities. I know there are conversations underway for expanding drive-through options as the weather improves in several places, and so I anticipate you'll be seeing more of those options as we move into the spring and summer months.
Thank you for that. And our final question goes to News 3 in Madison. News 3 in Madison. WISC in Madison, *6 will mute and unmute your phone. All All right, with that, we will conclude today's briefing. I want to thank Deputy Secretary Julie Willems-Van Dyke, Dr. Stephanie Schauer, and all of you for participating. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.